Hello and welcome. My name is Alana Gordon. I'm a reporter and producer at The World. This is a Facebook Live Q&A about a new respiratory illness known as COVID-19. So much is happening, it can be hard to keep up. Ships in quarantine, cities on lockdown, trade and travel on hold, and of course a global race of scientists trying to understand and get ahead of this new virus. Which brings us to all the questions, your questions, a situation like this presents. And so we're talking with Michael Minna. Hi, Michael.
Hello.
Michael is an epidemiology professor and infectious disease specialist from the Harvard Chan School and a physician at Brigham and Women's Hospital. You can post your questions for Michael and me on our Facebook pages at Forum HSPH and at PRI The World, or you can email them to the forum at hsph.harvard.edu. This Q&A is jointly presented by the Forum, the Harvard T.H. Chan School of Public Health, and the World from PRX and WGBH. Also, if you want to listen to a conversation between Michael and the host of the World, Mark O'Werman, you can check it out at pri.org. This is a continuation of that conversation. Michael, we also were right here in the studio 2 weeks ago talking about this new virus. Mm-hmm. So I wanted to kick things off and ask you, what has changed since then? What is the scope of this spread of this disease?
Yeah. Sure. So in some ways, a lot has changed, and in some ways not a tremendous amount from a global perspective in terms of infectious diseases. But I think it feels like it's been forever ago that we spoke, and it's really only been a couple of weeks, like you said. I think the biggest thing that's really changed since then is it's become more increasingly clear that the quarantines in China have not necessarily served to stop the spread of this virus globally, but they did probably slow it down considerably and sort of buy the world some time. I think since we spoke last, the global community, or at least the infectious disease epidemiology community and policymakers, I think people have become more and more I don't want to say comfortable, but have come to the conclusion that it's very likely that this virus is going to continue spreading out throughout the world over time. And so things have really shifted a little bit from really trying to stop its spread in China to now saying, what can we as a global community, as individual nations, and even as individual hospitals do to prepare for what seems more and more potentially inevitable, that we will start seeing cases locally throughout the world.
Well, I want to get to some online questions. Mm-hmm. So I'm going to kick things off with a question about the numbers. This comes from online. I'm confused why numbers being reported from China jumped last week. And can you explain what officials did in terms of counting cases? And this kind of speaks to that. Mm-hmm. Monitoring of diseases. Yeah, this
was really a confusing thing, I think, for a lot of people. And what really happened was there was the initial case definition to allow somebody to allow an official report of a case to go in required molecular diagnostic testing. And that's this test that we call PCR. And it's something that is very routine to do in hospitals throughout the world, for example. But what became more and more apparent was that as the resources in China became stretched, PCR assays, these tests, were not necessarily being applied to everyone who probably should be getting one in order to really get a positive result if they were positive. And then it turned out actually some of the tests aren't even working as well as we had hoped, as we had hoped that they would be working. And so there was actually a change in what would be allowable to allow to allow a case to be formally reported, and that was to use more clinical definitions, including scans of the lungs to see if somebody actually had what looks like a coronavirus type pneumonia. And so it really shifted a little bit to allow an increased number of patients to be reported as positive for this virus, even in the absence of a molecular-based test using real clinical diagnostic criteria. And so what that did was that there was already this sort of built-up backlog of patients who fit this criteria but had never been diagnosed using the molecular test. And so the moment that that the definition changed and these other cases that had been clinically apparent to be coronavirus were allowed to be counted, all of a sudden in one day there were 14,000 new cases that popped up. And so if you look at these graphs, you see this one big spike, and then it comes down a little bit, well, quite a bit from that. So that was really a reflection of this change in definition of what can be counted as an official case. So it wasn't that there was in one day a huge number of new individuals. It was really a reporting issue. And that's kind of subsided, and now it's really a combination of both the molecular tests and the clinical cases being both reported together as the formal reports.
So this question comes from Lisa. In today's issue of the journal Science, researchers report the structure of the spike protein that the virus uses to gain entry to host cells. They say it may inform efforts to design a precision vaccine against the virus and efforts to design antivirals. What is a spike protein and why does it matter?
Sure. So the spike protein is viruses use different molecules that they express on their surface in order to actually bind to human cells. So unlike a bacteria, which a bacteria can sort of replicate on its own out on a surface or in different media, a virus actually doesn't have all of the machinery to allow itself to replicate, which is why there's sort of a philosophical discussion of whether or not a virus is actually a true organism or not, or if it's more like a robot. And so a virus, in order to get into a cell and sort of hijack a person's cell machinery in order to replicate itself, it needs to have a molecular receptor to bind to. And so the spike protein is the piece of the virus that actually anchors on and binds to a human cell. And the reason why that's so crucial to understand the shape and how it looks and sort of what the structure is if we can figure out how to sort of take maybe an antiviral drug, for example, and have it bind to that spike receptor, maybe we can actually block it from then being able to, if we can get a drug that binds to the spike receptor, maybe we can stop it from being able to bind to a human cell and prevent replication in the host. So really understanding the architecture and the structure of proteins is one of the basic fundamental things in modern vaccine biology and modern therapeutic development that we try to do pretty rapidly with a new virus like this, so that we can start sort of making more educated guesses and efforts at how to develop new therapies and vaccines.
So this question also comes from online. I'm kind of skipping around because I have some other questions, and so do people online about the disease's spread, but how realistic is a hope for a vaccine?
I think time will tell, but I think there's been a real change from, say, 50 years ago or even 15 years ago. And modern vaccines are now being developed. There's new technologies to develop what we call RNA vaccines and different viral-like particle vaccines. We can now synthesize the pieces of viruses or genetic code that might make up a vaccine very quickly and very accurately now, and for much, much cheaper costs than just a few years ago even. And so I think the background and sort of the infrastructure is now in place to reliably produce real rapid development of vaccines. So the question now is, can we find the parts of vaccines that will elicit true protective immune responses? And that's actually the hard part. So I think the infrastructure is in place, the technology exists, and now the real question is, once we start giving these vaccines in a trial, in sort of phase 1 vaccine trials for safety, and then beyond that into phase 2 and 3, will we see that they actually work? And that, frankly, is the unknown. Nobody to this day has made a good coronavirus vaccine. Granted, before SARS, there wasn't too much interest in making a coronavirus vaccine, because it's usually just these viruses normally cause the common cold, so it wasn't a heavy target for vaccination. My personal feeling is it will be successful. I do think that that we'll be able to come up with a vaccine for this virus Do I think it's going to be available to the wider audience of the world anytime in the next year? I don't really think so, but I do think that at the very least phase 1 trials will be introduced and started hopefully later in the spring and early summer, which in the world of vaccinology is extraordinarily fast. So my hope is that there will be something available.
This question comes from Eldana. Do we know how long the virus lives on surfaces?
This question has come up a lot in the lay public and the media. So there's different reports, and they stretch anywhere from a few hours to days. I think the evidence suggests that certainly for a few hours, the virus remains sufficiently viable in sufficient numbers to really allow transmission through that route. And that's called, essentially, if you have virus that's on a surface and then you touch its surface and touch your face, that might be a way that you can acquire the virus. How important that mode of transmission is yet to be determined. It might be a very small fraction of people who are actually acquiring or transmitting the virus through this sort of surface transmission route. To answer the question, though, I think there's evidence that suggests that the virus can technically persist for days on a surface. And there was even some reports of like 9 days on a surface. But the question then becomes, well, even if you could, in sort of perfect laboratory settings, actually culture some of the virus off of a surface after a few days, would that have been enough so that if somebody actually touched that surface and wiped their face, could they have actually gotten it infected with it? And that's a big if, I think. But probably the biggest concerns are within the first few hours. And I know that this has come up because people say, well, I'm getting packages shipped to me from China. Should I touch them? Is this a way that it's going to be spreading? And I think that the potential for that is pretty low.
So this is a question from online from Arnether. Can Americans get the virus from ones who were over in China and have returned to the U.S., might be working, cooking in various places?
Well, there's now been pretty good efforts to quarantine people both from just stopping people traveling directly from China into the United States. And then when people do come in, there are efforts to quarantine people for a couple of weeks. For example, the individuals who have recently come off the cruise ship are now being quarantined for an additional 2 weeks, I think, on military bases. So on the one hand, I think that the U.S. is doing, and other countries are doing, due diligence to stop this from occurring. But at the same time, if somebody had sort of left China through whether legally or not, if somebody's sort of getting out of their location and they're bringing an infection with them, or this is spreading not just in China now, also in Hong Kong and other places we're seeing it. So if an infected person comes into the United States, then that is a concern. That's the major concern about how this might transmit. I would definitely not say that that the risk is highest, for example, in Chinese restaurants or anything like that. It's I know that there's been a lot of unfortunate reports of people becoming scared of people, just going to Chinatown and things like that. And even just here in Boston, we had there was a big event the other day to try to tone down some of this anxiety and fear around going to Chinatown and going out to eat at Chinese restaurants. And I think that that's good. We should not be afraid of that being sort of that there's excess risk when you go into Chinatown. But certainly people bringing the virus in is the major concern.
We've gotten several questions from people about travel and what should be done, decisions about traveling and risk. So for example, from Anne, she has a question about her 23-year-old daughter who will be starting a 1-month-long wilderness trip with multiple 60-year-old plus people after she'll be returning, a few days after returning from Southeast Asia in March. And she also visited Beijing in January, and she says that she had an illness and sore throat, worse than a typical respiratory infection. So she's wondering if maybe she got the COVID-19 and maybe is immune, but is it possible to get a test and check for this before going out for something like this?
Thank you for her asking that question. It's really important, I think, for somebody who, especially in this case where it sounds like she had symptoms, it very well could have been this particular virus. And because especially in younger individuals, it's showing to be mild, if not completely asymptomatic. I think it's extraordinarily important for people who have had symptoms like this to ensure that they're sort of self-quarantining for a good amount of time, 2 or 3 weeks potentially. And afterwards, I think that the likelihood of her transmitting it to other people is extremely low. If it's been weeks and since, or over a month since there was any illness. At the moment, there's no good test that's available for people to be able to know if they have been sick in the past with this virus or infected with it. But there's a tremendous amount of effort going on by diagnostic companies and by research labs. It's something that my own lab is doing to develop what we call serological tests. And these are tests that, instead of looking for the virus, they actually look for the body's immune response to that virus in the form of antibodies. And so we can, if somebody has been infected a month ago or even a year ago with a particular pathogen, we can look for antibodies, which are essentially like little records of a history of having that illness or that virus, and say, yes, you were probably infected at some point in the past. At the moment, though, unfortunately, those tests are not available, but my guess is within a matter of months, they will become pretty readily available.
Perhaps not before that trip.
No, maybe not before that trip, but if it was truly months ago or in mid-January that she had felt ill, I don't think she needs to worry too much about spreading it to other people at this point.
That's a question about if you have been infected and reinfection. That's also come up in an online question.
Yeah, so we don't know enough to know, is it technically possible somebody can be reinfected with this virus? Absolutely. We don't. But is it common? Probably not. And that's because in order to clear the virus, your body has to make these things called antibodies and have an immune response. And usually, at the very least, for most viruses like a coronavirus, we form a sufficiently robust immune response to prevent us from getting the infection a second time, at least in any short duration of time, usually 6 months or a year. Is like kind of the minimum that we would assume that immunity would last for. But do some people not have a sufficient immune response to really prevent them from getting it a second time, for example? That's theoretically possible, but it's probably not common.
This leads to a question from Joe. We're hearing a lot about cases, reported cases, deaths, but do we know about patients, how many are post-infection, or just how that compares?
Do you mean recovered in terms of,
how many more have passed away and how many new cases there are, but what about for those who have recovered, who've tested positive and are no longer infected?
Yeah, so I think the world has sort of been watching these statistics come out, or these numbers come out of China and internationally of the numbers of cases that are being reported and the numbers of deaths. And a lot of people have remarked on how the number of recovered people is much, much lower than the numbers of cases. And I think there's probably 2 reasons for that. On the one hand, it might take a few weeks for somebody to truly be declared as fully recovered. But on the other hand, if people are leaving the hospital, they get their molecular test or they get diagnosed, and at least in Wuhan, for example, where there's just been thousands and tens of thousands of cases, they're not able to maintain and keep everyone in the hospital under isolation if they become positive. And I imagine that many people are getting sent home to be in self-quarantine. And for those, it's probably very difficult to follow those patients and know, are they recovered? And so there might be a large number of people who just aren't being monitored. And so that could be a reason why the numbers of resolved cases is much lower than we would anticipate at this point. It's just that the monitoring isn't being done. So I would put less weight on those numbers that are really being reported for resolved cases. And I would also say that we don't have a good understanding at this point of what that number should be. But I think given the case fatality rate of patients who are being reported is sitting around 2% on average, I think we can assume that most people are recovering.
This is a question that just came in from online. Speaking of fatality, how deadly is COVID-19 compared to something like the flu, SARS, MERS?
Mm-hmm. Yeah, it's something it helps people, I think, contextualize this virus to put it in the context of something we're all familiar with, which is flu. So our reports right now are suggesting that the mortality rate is somewhere around 2%, which is somewhere around 10 times or more greater than flu. That said, the numbers that we're getting still might be the tip of the iceberg. It's very likely, I think the most likely situation is actually that there are many, many more people getting infected with this virus in China than are being reported. And that's just because it's a strained healthcare system. And so that would really increase the overall number and really change that ratio maybe from 2% down to 0.2%, for example, if actually 10 times more people are infected and exposed than who are being reported. And that, I think, is maybe the critical piece of information that continues to remain unknown in this epidemic. And it's because so much of all of the efforts at this point are really focusing on the people who are sick enough just to present to a healthcare facility. Now, there are new ways to look at this, or different angles that are being explored, and that's looking at international cases where we know, okay, there's been a number of people who are maybe infected in one country, and it's a more discrete population, and you can start to survey the contacts of those people to know, okay, what's the true denominator here? How many of these people are actually getting ill, and how many of them are dying? But right now, there's been so few deaths outside of China that it's really hard to use that approach to really get at a case fatality rate. My guess is it's probably going to be significantly less than 2% overall. That said, in adults over 50 or 60 years old, it might actually be around 2%, and that's it seems to really be hitting the hardest for as you get further and further in age. I think a most recent report from China came out and said that people over 80 years old who got this virus, the current mortality rate of reported cases has been around 14%. So that's very high. Overall, I think this will be a lower mortality than SARS, for example, and probably a little bit higher than flu.
So there's a few minutes left, and we've gotten a lot of questions about preparedness, kind of bringing it back to the beginning of our discussion. This question comes from online. If the virus is found in areas of Africa with what might be poor infrastructure, what would your first piece of advice be to the area's leadership?
This is a really big problem, I think, and it's one thing for this virus to have these major outbreaks in China, where they have this very strong government, sort of famously strong government and heavy hand, and they can quarantine whole cities. The big fear, I think, amongst epidemiologists is this virus spreading in places like highly dense places in India and Bangladesh, and in countries in Central and Western Africa, Eastern Africa. I think that the basic message should be for everyone to continue to take precautions, and sort of it almost would have to be at a real individual level. That I think that there's only so much that governments, if it becomes widespread in New Delhi, for example, where there's just a tremendous number of people and very limited capacity to sort of govern in the way that we've seen happen in Hubei province in China, I think that the best precautions individuals can take is to do what we've all been recommending for people in the States, which is wash hands, be conscientious about about not touching your face, and really trying to avoid, I think if it starts to spread, trying to avoid as much as possible really public places. But that's going to be very, very difficult. People have to get on subways and trains and go to markets to get food. So this is sort of I wouldn't say it's a doomsday scenario, but it's really it's the scenario that is going to be very difficult to control.
That's at like the personal level, but what about at more of the like community or like governing level? Any advice for preparedness?
I think one of the major things that that governments can do at this point is to prepare their hospitals and their clinics as well as they can. And for example, I was in Israel recently, and I was very, very impressed with their preparedness. And at Sheba Medical Center, which is sort of their national hospital and public health labs, sort of like our CDC, they had set up a big triage tent. And so they were actually diverting individuals who they thought might have this illness. They were actually diverting them away from the central emergency room into a tent to get tested and triaged. And that's something, for example, we haven't really seen much of that type of approach in the United States at this point. So I think governments can start to plan ahead of time, assuming that they're going to get an influx of excess patients who, even if they're negative, they're going to have to be tested for this virus to make sure that they don't have it. And so doing as much now as they can to get diagnostics online, to be able to know this is what we're going to do to test, this is what our case reporting is going to be, this is what the definition is that we're going to use to say this person is or is not infected. I think all of that is something that governments and hospital infrastructure can be doing right now to prepare for this.
Which brings me to this other question from Tim, which is what are the most recommended cautionary preparations that U.S. hospitals might implement to minimize the effects of localized coronavirus infections?
So when a patient comes into a hospital now, each hospital might deal with it a little bit differently, but the idea at the moment is to test somebody for it using a molecular test, these PCR tests. Unfortunately, at the moment, most hospitals will be taking a swab from somebody and sending those to a state lab, which at the very moment is usually sending that to the CDC. So getting the results back might take anywhere from 24 to potentially 72 hours, depending on transit and how long it takes the sample to get to the lab. So in that period of time, there's going to be questions what to do with this patient if they seem to be positive. And I think depending on a hospital's capacity, they're going to either want to triage that person. If the person needs to be in the hospital, they'll want to put them in some sort of isolation room, so a room that's sort of not shared with another person, for example, and hopefully that's even maybe negative pressure so that the pathogen will not escape from the room if somebody's breathing inside the room. And then the hospital staff should have the correct protective equipment to protect themselves from getting ill. And that's something we've seen, for example, in China has been a really big and sort of devastating problem. I think there's something on the order of 1,600 healthcare workers and staff who have now become sick with this virus by trying to do their job and work in the hospital system and the healthcare settings there. And we don't want to see that happen in the United States. We want to make sure that our staff are as protected as possible, and nurses, physicians, and laboratory staff, and everyone who might come in contact with the virus. So I think it's important for hospital administrators to make those supplies available and make sure that they're available up front, at least for a limited number of staff who might be dealing with patients with suspected coronavirus.
So we have time for just one more quick question. It comes from online. Are you concerned about this virus mutating?
I don't think that's not my major concern, no. I know, we don't know. It's almost pointless to speculate. Viruses can mutate and become more severe, or they can mutate and become less severe. And in the case, a lot of times viruses might mutate and become less severe as an illness to improve their transmissibility, for example. So I don't know that it's actually very worthwhile thinking about this mutating. And this particular virus, the question arises a lot because there's a lot of fear about flu mutating and getting bird flu and things like that. It's a really different type of virus. The flu has a whole different sort of genetic makeup in the way that it can mutate and make like big shifts that could create different types of virulence and pathogenicity. This virus, I think, it has it's a little bit more limited in the ways that it can mutate, just for reasons I won't go into detail, but so it's not my biggest concern, no. I think being prepared for what we're currently seeing occurring at the moment is really the biggest concerns are how to get populations equipped and ready for this virus to spread.
Well, that sounds like a good place to wrap up, even though there's many more questions, and hope we can continue this conversation, but thank you.
Absolutely.
And so that concludes our Facebook discussion about COVID-19. You can view the full discussion on our Facebook pages and send feedback at Forum HSPH and at The World, at PRI The World, I should know that. And so again, let's keep the conversation going. And in fact, on March 2nd, you can join us, The World and the Forum again, for another forum on the coronavirus.